So in the last video, we just found out what HIPAA actually is. We also talked about the 5 titles of HIPAA. So again, in this course, Title 2 is probably the most important because that covers the privacy and security rules. So in this video, as I mentioned before, we're going to talk about the privacy and security rules. So let's talk about the privacy rule first. So basically this one set the standards for protecting your PHI and your PII. Now, one thing to note, the differentiation between the privacy rule and the security rule, besides many things, but the major one is that the security rule covers ePHI. So make sure you remember that, especially if you're having to take some type of exam related to HIPAA, you'll definitely want to know what that is. Now, the privacy rule basically established for covered entities that they had to protect your information. Now, they can reveal PHI to facilitate like treatment. So let's say you have a gunshot wound, they need to share that with a surgeon or something like that. If they are trying to facilitate payment or like other healthcare operations, those are kind of the situations where they can go ahead and do something and reveal your PHI information. So what's a covered entity? Essentially, a covered entity is going to be, your hospital, your doctor's office, your individuals that work for those organizations. They don't have to be directly. So like your IT professionals are still bound by HIPAA, and also any types of business associates that you have in with your organization. So let's say that I'm a hospital and I'm using like a third party to do my medical billing for me to get paid. That company as well has to abide by HIPAA. Now, the privacy rule also covers things like if I disclose a patient's information without getting prior written authorization from them, so basically the privacy rule is covering all forms of protected health information. So not just like electronic like the security rule does. This is specifically covering like your generalized stuff. Also, upon a request, so like basically if a patient wants their medical information, the privacy rule requires you to provide that to the patient within 30 days. So you'll see a lot of times, a lot of doctors' offices might go slow with you, so that you're trying to get your records, etc., like that. Basically, again, nothing in this course is legal advice, but just put stuff in writing. Don't just call them on the phone and request your stuff. Like put it in writing so you can start tracking that, so that way you can abide, or you can make sure they abide by HIPAA. What the privacy rule also requires of covered entities is basically they have to make a reasonable effort to share just the minimum necessary information. So as an example, if you've got 2 doctors and you go to one, let's say you go to your family doctor, general doctor, and they refer you to a surgeon. And all the surgeon needs to know is that you've got a certain diagnosis. They don't need to know that, in the 4th grade you were, ill with whatever, you got the flu or whatever. They don't need to know that information. So what your doctor needs to do is basically look at your chart and only send over the stuff that's applicable to the surgery they want you to have, right? They don't need to send every bit of your chart. Now, in some cases, they may ask you to, sign a piece of paper that says, hey, you can take my entire chart. But if they're just sending it without your approval, to that surgeon, without your written approval, what they'll just need to do is limit it to whatever is applicable to the procedure or treatment being done. What the privacy rule also does is it allows an individual, so like if I go to my doctor and they've got inaccurate information in my chart, I can basically demand that they correct that inaccurate information and make reasonable steps to ensure that information is the confidentiality of communication is reasonable. So what that basically means is if I've got inaccurate information in my chart, the doctor, has to correct that information. And as a part of that, they have to be confidential in all that communication with me regarding that information. A side note, I want to share a story actually from my past as a nurse. I worked at a cardiology office, and one of the doctors, as part of his assessment on the patient, he had typed up a notation in there about the fact that the patient had stated they smoked, I think it was like 2 packs a day or whatever, cigarettes. And that was a couple years prior. And then what happened is the patient was trying to circumvent the system, essentially. They were trying to get like a better health insurance rate. So what they wanted the doctors to do was alter the chart information just so they could get like a discounted rate. And it was a whole fiasco. It was actually interesting. The patient, retained attorney, all that stuff. But at the end of the day, the doctor didn't have to change it because it was a real, it's really what happened, right? You're documenting what actually happened as a clinician. And so the doctor didn't have to change it. But that's an interesting story because that's basically somebody gaming the system, right? At least in my opinion, it is. And so you may see those situations out there where, somebody sees that, hey, under HIPAA, they have to change the information. Well, only inaccurate information, right? So if you did smoke like 2 packs a day for 20 years, guess what? If your doctor puts that in the chart, in most cases, they probably can leave that in the chart. So don't try to get cheaper health insurance just because to do so. So I wanted to share that example. Actually, it actually just came to me as we were talking about having to change the information. I want to share that because, as I mentioned before, like people will try to game the system, right? So that's why we have legislation in place to try to mitigate that. But there's always somebody that will try to figure out a roundabout way on how to get around certain laws. Now, the privacy rule also requires covered entities, so like your doctor's office or the hospital, to notify you, basically how they're, keeping track of disclosures, how they're using your information. So when you go like to the ER, they'll have you sign a form in most cases. And for those that don't know, those outside the U.S., ER is emergency room. So for that situation, they'll usually have you sign, a form or a couple of forms that basically, tell you what they're going to do with your information, how they're going to share it, any types of privacy policies or procedures they might have in the hospital. So you'll, when you go to different procedures or different places for healthcare, you're going to sign a bunch of paperwork, whether that's, just physically signing it or signing it electronically, but in some capacity, they're going to be providing you all that information so that way you know what's going on with your health information. Now, if you're like me and most other people, you don't actually read any of that paperwork because you figure out what's going on. And then if something happens, you're like, oh man, I can't believe I signed that type of thing. But I only do that with all the privacy notices because I've already read like 1 million of those in my life. Now, the privacy rule also revised the definition of significant harm to an individual, basically when HHS or some other, so basically it causes there to be more of an investigation to covered entities, so that way they can potentially say that if there's any other breaches that were not previously reported. So essentially, significant harm, if there's a cause of significant harm to the patient, not harm. We hope there's nothing wrong with your arms. But what that does is it basically allows HHS to go investigate these entities and say, oh, wait a minute, these other things should have been reported as breaches as well. Here's your big old fine. Pay all this money to us, or here's your criminal charges. And then the other thing to note with Title II here, so this is basically related to the Omnibus rule update that happened in 2013, but the protection of PHI was actually changed. A lot of people don't know this if you haven't researched all this. The protection of your PHI was changed from indefinite to just 50 years after your death. So just keep that in mind that, you may want to try to want your PHI to be protected after 50 years after your death, which you probably don't care about because you're dead, but your family may care about. So just keep that in mind. You may want to research that more. And then the HIPAA privacy rule, the Omnibus rule update in 2013 actually allowed, and we're actually, we talk about national disaster a little bit, but the Omnibus rule update was basically made a change where the HIPAA privacy rule can be waived during a natural disaster. So very important, so understand that as well. So you may want to deep dive into HIPAA a little more outside of the scope of this course to understand all those components. And so, as I mentioned also that a patient has a right to access their information, right? So within 30 days, they have to be provided the information, a copy of that information. So there is an exception there. So psychotherapy notes from a provider or information that's gathered by a provider to defend against a lawsuit by that patient or any lawsuit, that's not covered, right? So I can't request and see what my doctor is doing to prepare for the lawsuit against me. I can't request that information. I can just basically get my healthcare information from my record. And it also allows the provider to charge a reasonable amount for copying costs. So They can't charge you like $500 a page. That's unreasonable. I forget the exact amount that's kind of standard out there, but in most cases, it's like 10 cents or 50 cents a page, depending on the provider you're working with. Most of them just charge like 10 cents. A lot of them will actually just give it to you for free, especially if you're, as we're going to talk about here in a second, if you're going to do it through electronic form, they'll normally just let you get it. So what you have to do as a patient, you basically would have to authorize delivery of the information, using like encrypted or unencrypted email. I don't recommend either of those, by the way. Using media, so like getting it burned to a disk and having that be an encrypted disk. And most providers will do that as a standard of practice. They'll burn an encrypted disk, they'll send it off to you, and then they'll send you a separate password somehow, or they'll call you on the phone once you've received a disk and have you unlock it at that time. Also, like direct messaging, so if they've got encrypted like email or something like that, or encrypted chat features. In most cases, you're not going to want your doctor to text you, even though it's encrypted on their end. And technically under HIPAA, they probably would be covered. You just don't want it on your end because you've probably downloaded that fun game and some criminal hacker is already got spyware on your phone and taking a look at it. And, again, the individual or like us as the patient, we can request in writing that, your provider send the PHI to a designated service. So I can say, hey, send it to my doctor's office, send it to this, company I'm using, send it to my attorney. So I can basically, as a patient, I can designate where that stuff goes. All right, so in this video, we talked about the privacy rule. We kind of took a deeper dive into that. We're going to jump into the security rule in the next video and take a look at that. And then I suspect, based off how much I'm talking here in this course already, we may actually have to do another video that covers the actual financial and criminal liabilities or penalties for the HIPAA legislation. Just because I tend to talk a lot, I like to throw examples in there for you. So in this video, again, we cover the privacy rule. In the next video, we're going to cover the security rule.